are watching the medical segment of the Jennylyn Show, and I am Jennylyn Gleave, your host. On this segment of my show, various physicians will be debunking myths associated with their specialties and sharing what is new and cutting edge in their fields of medicine. Today, Dr. Massoud Mahmoudi, allergist and immunologist, will be debunking medical myths associated with allergies. You may be surprised. Some of the myths he addresses in this segment are common. If you are someone who suffers from allergies, stay tuned. You may discover you too have believed some of these myths. So here is your chance to find out the facts and make changes if necessary. Here is Dr. Mahmoudi.
I'm Dr. Massoud Mahmoudi. I'm an allergist in the Bay Area, Northern California. And I'll be discussing myths and facts on allergy topics tonight. So one of the myths is my allergies are bad and I need to stay inside and don't go anywhere. So is that a fact or a myth? Well, depends on what kind of allergies we are talking about. You know, people may be allergic to a variety of pollens and or indoor allergens like dust mite, molds, and pets. And if they're allergic to outdoor allergens such as grasses, trees, and pollen, you know there are different seasons. And then the more allergies they have, the more involved they are, and the more symptoms they have. So if someone has allergy to pollens, and depends on the region, they may have symptoms all year round. The other problem is the indoor allergens. Indoor allergens, unfortunately, is all year round, like dust mite. And if you have pets like cat or dogs or mold at home, then your symptoms are all year round. But otherwise, there are people who unfortunately they have a difficult problem to go out. But again, if the allergy is minimal and they're during a specific season like grasses, then they may have a problem in certain days of the season to go out. So if I have no childhood allergies, I'm not worried. The thing is that adults, most allergies are allergic rhinitis, medically called allergic rhinitis as far as terminology, or the typical hay fever symptoms, hay fever. They usually start in childhood, but there are times that rarely we notice that adults develop allergies. Or one explanation is that you may always had some colds that you thought it would never go away, or you have frequent cold symptoms and you thought I was always cold, but actually, in fact, that may have been allergy. So by the time the symptoms get worse, you go to allergists and they diagnose you as being allergic to specific pollens or some allergens. But usually allergies start in childhood, but there are some cases, not as common, that you notice you have allergies in adulthood. Food allergy may be a little different. By the time you're adult, you have pretty much experienced variety of food and even different ethnic food. But sometimes it's possible that you are exposed to a new food with some new ingredients that you've never been exposed before, and you may be genetically predisposed or have been a couple of unknown exposure in the past. You may develop allergies as adult. But usually, as far as hay fever allergy, mainly in childhood, sometimes they're rarely in an adult. You may see some symptoms and be diagnosed in later in life. So I need to get a dog that my sister is allergic, so I want to get a dog that does not shed. Is that a problem? Usually, there are various type of dogs or cats when you want to choose a pet, but in reality, unfortunately, the allergens are always there. The allergens, they may be in the pelt, like if you get a cat, saliva, sometimes in a male urine, like in terms of cat and dog. So it's possible that you get a cat or a dog that they shed less or less hair or something, but unfortunately there is not such a thing as hypoallergenic cat or hypoallergenic dog. They're all, theoretically, all can cause allergens. It's possible that one brand, one type of dog or cat to other may be a little better, but again, unfortunately, the allergy is still there. Eliminating wheat and milk eliminate asthma and hay fever. Usually people who have allergy to milk and wheat, they may or may not have hay fever, so they're really two different things. People who have allergy to milk, the good thing is they usually outgrow it by age 8 or 10, and sometimes as teenage, they're outgrown of milk allergy. So as wheat, majority, in fact, children outgrow majority of their allergies by teenage years. There are only few exceptions, and that is peanuts and nuts, tree nuts, and shellfish. They usually stay for life. There are some studies that show 1 out of 5 affected individual, like that would be like 20%, they outgrow peanuts as well by age 5. But majority of cases, they usually stay with you. Now, if you eliminate milk, there are some people that may have problem with milk, have like exposed to, but after ingestion, they may wheeze or something, but that is not as common. But if it happens as you grow older, as the children grow older, they may outgrow this. Does it prevent it? If you have problem with the milk as a child, then it may help you to avoid them and be less symptomatic. But usually the food are outgrown by teenage years. Celiac disease is a childhood disease. Well, you may see celiac in children, but in fact it can happen anywhere from infancy to adulthood. So it can happen in any age. And what it is basically the area of small intestine, which called villi, they are responsible or are involved with absorption of nutrients. And somehow when you take gluten, which contains a protein called gliadin, and then when you take those products, those ingredients that have gliadin, the protein of the gluten, then the villi are damaged. As a result, you don't get good absorption. But it can basically happen in any age. Celiac individuals who have a problem with celiac, they should only avoid wheat and wheat products. Well, the thing is, they have to avoid anything that has those protein, and those are usually wheat, barley, rye. There are a variety of food items that they use wheat and barley, pizza, there are a variety of food, any kind of cake or breads. So they have to just be mindful and watchful of reading labels, reading ingredients, and then avoid them all if possible. People who are allergic to shellfish are also allergic to iodine, and that is definitely a myth. There is no relationship of iodine allergy and shellfish. People may react to iodine, but that is completely different, has nothing to do with the shellfish. So that is definitely a myth, and there are two separate things. If you build allergy to one brand of medication, you may develop tolerance to that particular medication. I hear that a lot from my patients, that they use a specific type of antihistamine for a while and then that stopped working. Although it is possible, but if overusing it or something, it's possible, but usually depends on the type of symptoms that the patient have. At some time they start medication late, or the symptoms are so much that they can't, the medication doesn't help, and that's why people think that medication stopped working. But in actuality, the medication should not lose efficacy. In certain situations, when we see patients who are using some type of inhalers, like bronchodilators in asthmatic patients, they may lose their efficacy. But usually the medications should be okay. There are some rare cases that use the medication loses its efficacy, so they have to change the brand. Allergy shots don't work. In fact, there are many studies that scientific studies in medical journals that over and over have showed and proven that allergy shots work. Allergy shots has different names actually. The World Health Organization about 15 years ago, they call the allergen reagents, they call them vaccine. So this is like real vaccination. You are exposed to increasing amount of allergen, and your body builds a tolerance and you become immune. And then your body is able to develop a specific antibody to that specific allergen. They're very specific. So if you get allergy shots for cat, would protect you against cat, not dog. The same thing for trees. Certain trees you are, when you are protected for certain trees, to certain trees you are protected against that specific trees or the same family, not other trees. There have been variety of studies and they've been very successful, and that they all showed and have been showing that allergy immunotherapy or allergy shots, also known as allergy vaccination, are a very effective way of treating the allergic condition. You outgrow your allergies. Well, it may be true in terms of food allergy. Majority of food are outgrown by a few years of age. By teenage years, majority are gone. Peanuts, tree nuts, and shellfish usually stay with life. And as I mentioned, 1 out of 5, they outgrow peanuts by age 5, so like 20%. But hay fever usually stays. There are times, there are various factors involved in remission of allergies, and those are when you move to a new area, or if you're allergic to indoor allergen like dust mite, you may move to a different house that has no carpet, has no dust. All preventive measures are taken care of, so you may feel better. So your symptoms may be subsided and improved, but you may still have allergy. So under certain situations, you may feel better, your allergy may go to remission. Or if your allergy was very mild to start with, you may, with some improvement of mainly environmental, you may feel better, but they may recur again. So they usually do not go away. There is no way getting rid of house dust or dust mite. Well, my analogy is like washing your clothes in the laundry. You wash the dirty clothes, they keep coming back and piles up. It's the same for dust mite and dust allergy. First of all, the confusion is for some of my patients, they tell me they have a problem with the dust in construction area, or when they're doing carpentry work, they have problems. First, to clarify that is irritants. They're not really allergenic. They can cause allergic type symptoms or cough and stuff, but they're usually not allergenic. The house dust is allergenic, the one that they contain dust mite, the 8-legged organism that actually cause the dust mite allergy. But you can do as much as you can, and some of those measurements are removing carpet, washing your bed sheet with hot water. If the place is humid, keep the humidity below 55%, cleaning the countertops, and so forth. Those are the things you can do, but unfortunately the dust might keep coming back. Damp houses are as healthy as dry ones. The problem is some people that have dust mite allergy, and the humidity is good environment for dust mite, not only for dust mite, for molds and cockroaches. So unknown of their own problem, which is dust mite allergy, they go buy, they think the area is dry, so they buy a humidifier and they make their allergy worse. So those people, they should dehumidifier to bring the humidity down. And unfortunately, without knowing of their condition, they do almost the opposite. So the damp houses or buildings are not healthy. There are a variety of problems. Allergy is one of them. Then there are other conditions called sick building syndrome, which people get non-specific symptoms of allergy type or asthma-like symptoms just due to unhealthy environment. Could be toxins, bacteria, fungi, or the actual allergens. So the best thing is to go to a new building. But damp building or housing is definitely not a suitable environment for especially for somebody who has allergies. Upset stomach, abdominal pain or bloating is sign of celiac disease, celiac allergy. Well, those are actually very non-specific. Now, people who have celiac, they may have those symptoms, but not everyone who has those symptoms are celiac. In fact, it can maybe be alarming if you want to investigate or you're thinking in that direction. Check somebody for celiac, but actually those symptoms can happen in a variety of other medical conditions. But if you're suspicious of celiac, then you can be tested. If you really want to be tested, you might as well be tested first. Otherwise, you can always use gluten-free food, avoiding barley, wheat products, and the food that contains these ingredients. Dark skin people do not need sunscreen. Well, it all has to do with the level of exposure of dark skin and white skin. Some people wear white shirts or white clothing during the summer just because of absorption. But in reality, when you're exposed to UV light, you are exposed no matter the color of skin. So all of us have to protect ourselves against UV light when we go out, and with the level and frequency of exposure. If you have never been stung by a bee, you will never develop allergy, or you will not be allergic. Well, this is in a general term is true, but in allergies, when you're allergic to something, you have to go through a period of sensitization. So you have to be stung several times to react to the allergen, and that is true not only for bee sting, for also hay fever, but there are other factors involved. Now, there are some conditions that with the first bee sting you react, and that is not typical type of allergy. Type 1 is called type 1. IgE mediated allergy is a different type of reactions, more like a toxic reactions. So people may react with the first bee sting, but in general, you may need to be stung more than once to show your reactions and becomes so. In other words, you need a period of sensitization to that specific allergen. A little bit of peanut does no harm. If you're talking about in the context of peanut allergy, a true food allergy is not dose dependent. In other words, you may be exposed to very minute amount of peanut, even a dust of peanut, and you go to anaphylaxis or systemic reaction. But I hear from some of my patients that they are okay with 3 or 4 peanuts, but when they take more than a handful of peanuts, their throat start itching or they cannot tolerate it. So although that is a problem, but that is not a true food allergy. The true food allergy is not dose dependent. Only minute amount of food can cause a big spectrum, a large spectrum of diseases, some symptoms, including the anaphylactic, which is fatal. So anaphylaxis is a condition that if you look at the whole spectrum of allergic reaction, the anaphylaxis is the ultimate end of the spectrum of allergic reaction, and that several organ systems are involved: heart, lung, and other organs, skin, are involved, and then there is a organ failure, the heart failure, lung failure, and people die of those due to multiple vital organ failure, and those are allergic. They are anaphylaxis, called anaphylaxis, and there are one particular type of anaphylaxis that the region is mainly in gastrointestinal system. So the only manifestation or symptoms of reaction is severe abdominal pain and cramping, and that sometimes they call it anaphylaxis, gastrointestinal anaphylaxis. But what happens in anaphylaxis sometimes is the smooth muscle lining of the body that includes larynx, small intestine, they all swell, and all the mucous membrane, you get swelling, edema, and when it gets to laryngeal edema or larynx, swelling of larynx, people cannot breathe, the throat closes, and that is a severe problem. So you block the respiratory system. And in anaphylaxis, blood pressure drops, heart rate goes up, blood pressure drops, and there's this multiple system failure. As a result, people die. And unfortunately, that can happen within minutes, so it's really quick. So it has to be aborted right away. You can be allergic to shellfish without eating it. When we look at the problem of, and we talk about eating a certain food and react without being exposed to it, that usually does not happen because of the period of sensitivity. But in one particular area, it makes sense, because during pregnancy, mom who is allergic to peanut or other shellfish may transfer, and they would transfer all their known problems through to the fetus, and as the child is born, there may be a problem with that type of reactions. But that is why during pregnancy, we recommend not to avoid peanuts, tree nuts, shellfish, or anything that the mom is allergic to. Then they don't have to transfer all those to the newborn baby. But generally, you need a period of sensitization. So there are other factors involved, genetic predisposition and frequency of eating and exposure to that particular food. Sinus headaches are usually caused by allergies. People with allergy or the hay fever, allergic rhinitis, are prone to sinus infection. Allergy does not cause sinusitis or sinus infection, but by itself, but indirectly they can. And the reason is the nostrils and the nasal canals, they become swollen, and as a result, they may be blocked. And then there is no communication between sinuses and the air. So the secretions of the sinuses are not drained properly, and the fluid are kind of stagnant in that area. They may get infected. So in a way, allergic rhinitis or inflammation of the nose that are not treated properly, they may cause sinusitis. But in other words, the allergic patients are prone to sinus infection. If somebody is allergic to iodine, maybe also allergic to quinine. Again, these are two different things, and there are always possibility of people have multiple allergies, but they are not necessarily related. So usually person may be allergic to something, not the other, and then there are people who have multiple allergies. Sometimes in general, it is true that some people have one type of allergy, they may be prone to other type of allergy. For example, somebody has allergic rhinitis and eczema and asthma, they may be more prone to latex allergy, not compared to the general population, but usually these are all different entities. Flowers commonly trigger allergies. I hear that a lot. Usually the pretty flowers are not allergenic, and the reason is the pollen are transferred or transported by insect, whereas the typical allergies are due to inhalation of pollens, and those pollens are usually loose and are in the air, so they're aerosolized and people inhale them, and frequent inhalation and exposure to those loose pollens, they become sensitized and at some point develop allergies. But the pollens of pretty flowers or flowering plants are usually very tight and mainly transferred and transported by insects, and is not loose in the air, so you rarely see them aerosolized. So therefore, they are usually not allergenic. Is there any known cure for allergies? In fact, yes. Allergy immunotherapy or allergy vaccination is really a cure, because allergen immunotherapy or vaccination are immunomodulator, meaning that change the immune system, and is as if we are programming your immune system to defend your body against a specific allergen. So if you're allergic to dust mite, we can give you dust mite allergen, and that is a protein. And then you're exposed to a minute amount of dust mite, and then we increase those gradually, and it's called build-up phase. And at some point, maybe a few months, you reach to a level that your immunity, you are received enough allergens, and then your body has been producing antibody. So at that time, we give you similar injections without increasing the dose, and for the whole, after completing the course of therapy, which is 3 to 5 years, you're done.